Tom, are you on? Can you hear me?
I am.
Okay, your camera is not on?
I guess it is 3 o'clock.
Okay. John, are you ready? Okay, we're ready, Tom, if you want to go ahead and go. We're live.
All right. Good afternoon, everybody. Today is the 26th of February, and we're going to go through just a real quick COVID update and talk about some vaccines. I see we just have a handful of folks today, so this should go pretty quick. Tim Kaufman, Deputy County Manager, is on with me here to when we get down to some of the presentation today. First of all, let me start off by just giving a dashboard overview of where we're at with the virus today. If you're not paying attention to that, we've gone under the 5% infection rate since the first time in very early October, so almost 4 months since we've been to the infection rate that we're at today. The daily infection numbers continue to go down. The number of new cases of COVID continues to go down. Our testing numbers are also going down. If you're paying attention to the graph, back in November, December, January, we were doing as a community 5,000 tests and more per day. That number is now settling in at about 2,000 per day, and it seems to be decreasing. And we're hoping that's because there's less virus and not because people aren't testing, because that's still a very critical part of managing the virus. Based on these numbers, all of which are looking pretty good, Dr. Minz has amended his current health order today. And I want to have Tim Kaufman just kind of talk through with what the significant changes are in the order. So Tim, please.
There are two significant changes. The first is that the curfew has been lifted for bars and restaurants. And so restaurants will now be able to operate until 2 a.m. or whatever statute requires. The other fairly significant change is that we modified our gathering order to the point where entities that have a capacity between 400 and 1,000 can occupy, without approval of a plan, 25% of their fire codes. And so we still have the requirement that venues that have capacity of greater than 1,000 submit a plan that is reviewed and approved by the health officer or their designee. But now those venues between 400 and 1,000 can have a capacity of 25%. This goes into effect at 12:01 a.m. tomorrow. So after midnight tonight, that will be the new order, replacing the existing order.
I'd stop here and take any questions on the order.
Yeah, Michael with the Eagle. Can you hear me all right? You can. It was a little hard to hear you. I don't know if anyone else did. I think I heard a curfew lifted just at bars to 2 a.m. now.
Correct. The curfew has been lifted, and so bars and restaurants can be open until 2 a.m.
And what's it currently?
It's midnight right now.
Okay. And then the 400 to 1,000, that's any venue. They're not, before were they not allowed to do anything without submitting a plan, but now they're able to at 25% without a plan?
That's correct.
Thank you.
I'm okay. Seeing no other questions for the new order or the amended order, let me determine that we had appointments available going into next week. Nothing that we had available really going into the weekend, but next week that looked like there was some open appointments. So that was part of the reason to open the aperture and let a larger population group come in now. And I might just add that our demographic analysis shows that 65 to 70-year-olds, there's about 25,000 people in that demographic. So we anticipate this is going to take at 7,000 vaccines a week, which is what we're getting. You know, we're looking at 3 or 4 weeks of 65 plus. The second reason that we went to 65 and above is it gives us greater synergy with our area partners, our pharmacies and medical community. because we're all working within phase 2 of the KDHE guidelines, and their systems are better set up to manage 65 and above. They didn't really have the ability to go to a 70-year-old number without including 65-year-olds. So it makes a communication better between the health department now and the multiple community partners that are going to help us begin to distribute vaccines in the next few days. And then finally, I think part of this just shows the power of the media. We talked about this on Wednesday, and somebody specifically asked about 65 plus. And I think I'd gone into that we were going to probably try to roll it next week sometime, whenever the appointments seemed to open up. And just that discussion, and I think it was reported accurately, but just that discussion lit up our phone board at the health department, thinking that 65 and above could get shots now. So it just shows the power of your messaging out there when you guys put that out. That's the good news. It's good to have that information out. The bad thing is we're trying to keep that phone line pristine so that people can make appointments on that. Those that don't have computers or access to the portal, we're trying to keep that phone line open for people to make appointments. And whenever we get extraneous calls coming in, it diminishes our ability to best serve the public. So we're trying to be very clear and crisp with our messaging here, and please help us with that. On Thursday, yesterday, we did 1,685 vaccinations at the mega site, which is now at the library. I feel like, and I think Tim would agree, I think we're at full, we're at capacity now to where we're running smoothly down there. We've had many good comments about from citizens who have gone through the process that it is working quite well, and they like the environment. Today we are vaccinating about 1,480, and of course we're in the middle of operations right now, so that number could change slightly between now and end of day, but 1,480 is what we think we're going to vaccinate today. So just to summarize, we have given 28,599 first doses since we started vaccinating. We've given 14,564 doses of second shot. So when you talk about people who are now fully vaccinated, it's just short of that 15,000 number. And this is just county vaccinations. It doesn't count what community partners are doing. It doesn't count what the hospitals have rolled. So clearly that is a greater number. So to date, we've given out over 43,000 vaccines through the health department. Tomorrow we have 776 first dose vaccines scheduled and 504 second shot doses scheduled. So again, running well over 1,200 vaccines scheduled for tomorrow. Our focus right now is on 65 plus, K through 12, teachers and staff, and any healthcare worker that has not yet received vaccination. And it's important to remember as we continue to roll through these vaccines that no group is left behind. So for example, if we have a 74-year-old person out there today who didn't get their vaccine when we were doing 70 and above, they will always be able to get the vaccine as we open this aperture. So no one is left behind. We're not going to exclude you because you didn't get in at your particular the time your group was being served. Part of the big news today is I think we received 5,000 Moderna vaccine yesterday, which we transferred over to USD 259. So they now have the capacity today to give 5,000 new client shots to their teachers and staff to go along with the over 1,200 shots that they've already given. So their population size, last we had checked with Dr. Thompson, was around.
Wichita just eliminated the curfew.
Could everybody mute, please?
Wichita just eliminated the curfew.
Could we, whoever that is, could you mute your phone, please?
Well, since I'm usually in bed or close to it, between 10 and 11,
Yeah, a lot of people out there.
Thank you. Okay. So the last we had heard from Dr. Thompson is their population was around 7,800. So they're making great strides to get first shots into all of their teachers. We staff today, legal staff, manager staff of the county and health staff met with Dr. Mins to talk about next steps in this process. As we had talked a little bit about this on Wednesday. I want to emphasize going into this discussion, though, that our focus right now is on 65 and above and K through 12 teachers. That will be, everything next week is going to be focused on those two groups. But we did meet with Dr. Mins. He gave some general guidelines, which the staff is now going back and reviewing. We're discussing some definitional issues with KDHE. For example, defining what agriculture means in the phase 2 order, what a food service worker is. Is that does that mean restaurant workers, waiters, and waitresses? Is that part of that group? Helping us to define what congregate settings are. So there's some definitional items that we are trying to work out with KDHE because we want to make sure we stick to KDHE's guidelines on how we vaccinate the public. We are also, after hearing from Dr. Mins today, now reaching out to some of our community partners who will help us vaccinate regarding their capacities and what kind of IDs we're going to be requiring when people show up within these work groups to get vaccinated, how they're planning to sign people up. So we'll be having that discussion. We're also doing some additional population analysis. Higher education was put into the phase 2 grouping just recently by KDHE, so we've got to go back now and determine what Sedgwick County's higher education demographics look like so we can factor that into the model. Grocery store and food service workers. We have pretty good demographics on grocery store workers from our big distributors, but if food service workers include restaurants, we'll need to build that into the model. How many restaurants we have, a number of employees per restaurant, put an estimate number together so we can build that into the modeling. And then finally, once again, to the modeling between now and next Wednesday, when we hope to show the Board of Health Dr. Mins' guidelines, we are going to try to build a model that will begin to show these groups approximately when they can expect vaccination. And it all, of course, depends on how many vaccines we get. And we set today very similar to where we sat the last time we talked, which is we get 7,000 vaccines in per week for new clients. So we based the model mathematics on that. If we begin to get J&J, for example, if that's begins to roll in next week or the week after, and we begin to get several thousand more vaccines, we modify the model. It compresses everything, and we can get people vaccinated faster. But for now, we're planning this is going to take us several more months. We understand a lot of people are anxious, but we also have to understand and be patient that not everybody can be first, and we have to go through and do this in the best way possible. I do think Dr. Mins is, I do think on the top of the list that he had told us law enforcement, public safety is going to come up first. We had already had a number, hundreds actually, on our no waste list. But because that no waste list is so efficient, the health department is so efficient at vaccinating that at the end of the day, we have very few doses left that we have to give. And we've only given since the beginning of vaccinations, just 30 or to 40 vaccines to a wait list. And of course, when your wait list is 400 deep, that doesn't make much of a dent. So I know that Dr. Mins would like to begin to vaccinate components of public safety as soon as possible. So we will be working that up, but that will not be imminent within the next week. As I had said before, we are focusing on 65 and above, our healthcare workers, and our K-12 teachers and staff. So with that, Tim or I stand for any questions. We'll try to answer as best we can.
So Michael with the Wichita Eagle. So 65 and up, you switched that yesterday or today?
That was actually, Tim, you want to take that one?
It was announced this morning, and we opened up the portal this morning to appointments for next week. And the other thing, I want to make sure I think I understood this right.
vaccinations, you've given there's about 7,800 teachers and staff in USD 259, and you've given that, you already gave them 1,200 shots, and you just gave them another 5,000. So basically have almost enough first doses to cover everyone there if they want it at this point. USD 259.
That's right, Michael. The goal was originally, when this was announced last week, was to try to get all teachers and staff first shots by end of March. That was the governor's directive on this. Based on the amount of vaccines that are earmarked for teachers, we are pretty confident we can get first shot vaccines done within a couple of weeks. And the health department's moved on this very rapidly. A couple of actually a little bit too fast for a couple of districts. They wanted better planning time on this. So we think we'll get most of the first shot vaccines done within a couple of weeks. With 259, probably definitely. They were very organized, and they're going to get 3/4 of their staff vaccinated probably in week 1, and we'll pick up the remaining group in week 2. But some of the other districts won't be far behind. We'll have gotten first shots by the end of week 3 for sure.
Question from KMUW. Will the county add K through 12 teachers to its online portal next week, or is that just the districts handling it?
With him.
The plan right now is to add them at the end of next week. We think that most of the districts are going to be able to get their staff taken care of on site generally, but we will add an opportunity for scheduling for them by the end of next week.
Thank you.
Very good. We'll plan to see you all Monday, same time, and we'll have hopefully some updates. We'll see how the weekend goes, and we'll keep you up to speed. Thank you for your time and what you do.
Thank you.
Got it, John? John, you get it? Okay.